Hello, today we will introduce you our SculpLFT 4D HIFU vaginal tightening treatment and our machine skills. Okay, first for the HIFU treatment for vaginal, there will be two different probes with different depths for 3.0 mm and 4.5 mm. The precise energy focus is positioned on the vaginal collagen layer and the fascia layer. It yields focused ultrasound, produce 65° to 70° thermal effect, promote the reorganization and regeneration of collagen fibers in the deep vaginal mucosa. The fascia layer tightens and shrinks, increase the production of new tender tissues, changes vaginal dryness, promotes vaginal sex. The secretion of mucosa ensures that the vagina is moist and tender, mainly for breakage, damage, and the vaginal tissue damage, dryness, urinary incontinence, relaxation, and other problems are fully treated, which triggers the body to start repair and regeneration. Okay, after we know the working principle, we will need to know who can do the treatment with vaginal tightening or who cannot, who is the proper candidates for the precautions. For example, people who have no sex life experience, menstrual period, pregnancy, or just abortion are not allowed to do the treatment. Patients who with tumors in the vicinity of the vagina are disabled, or someone with the slight trauma on the inner wall of the vagina or moderate trauma is not allowed. Also, for the people who carried out 6 months or 1 year after delivery or someone with artificial breastfeeding is still carried out after 6 months is not suggested to do. Okay, now after we know the precautions, let's see the machine of the operation. Okay, this is SculpLFT interface. You can also set your own logo or design into the program. Click it. This is a vaginal tightening working interface. Before you do the treatment, you might need to do the vaginal elasticity testing so you can know which depth or the cartridge you can use. Okay, this is the vaginal elasticity tightening program. Okay, this is a airbag head to put into the vaginal inner side, and you will need to clean and disinfect the airbag head and apply the condom into it, and then put into the vagina. Then testing the elasticity parameters. We will give you a data sheet so you can see if the vaginal condition is good, just so or bad, so you can see how to choose the 4.5 or 3.0 mm cartridge to do the treatment. Okay, after testing, let's see how to use the cartridge to do the vaginal tightening. Okay, when you go into the working interface, you will see there are different treatment parameters. This is the round. Round means the total circle, the total degree one circle will do. And this is the angle. Angle means every time the handle works, every time the handle start working, how much degree the treatment area will rotate for. And length is the treatment area for the whole side. You can see there are 0 to 25 millimeters. This is a pitch. Pitch means the treatment spots, every spot's distance, every 2 spots distance. For example, there are, if we set it to 1 millimeter, the total length is 25 millimeters, so there are 25 spots, but you know it's very close, only 1 millimeter distance. If someone's vaginal condition is not good or very bad, you can set lower. But if the vaginal condition is nice or not so bad, you can set higher to make it less spots here. So the spots will much wider. The distance will much wider. So for example, if you set 2.5 millimeter, which means there are only 10 spots, so they can do the vaginal condition is not so bad. Yeah. Okay, power, treatment power is energy. We usually suggest do 0.6 to 1 joule. I will show you the other treatment parameters here. Okay, you can see when you do the treatment, as there are auto mode and manual mode. When you click this one, you can see now it's auto mode working. Put the ready, you can see the handle will rotate 2 circles to the initial place, which means 0 degree. It will rotate the handle automatically to the treatment initial position. Okay, after you set it to the initial position, now you need to set the round, the whole circle, how many degree you need. For example, we set it to 360 degree. The range is 1 to 360 degree. Okay, for the angle, as we are showing example for you, so we set it higher so you can see much clearly the differences. Click there, increase, let's increase to 30, okay, 20. Let's increase to 20. Okay, now start. And press this button. After you click the button on the interface, now start the treatment. Put the, you will need to put the ultrasound gel on the treatment area and then put a condom into it, then put the treatment handle into the vaginal. Okay, after all this done, press this button. You can see it will start working. And every time it will work for 20 degree. This is the angle, which means every time the degree it rotates for, as we chose the auto mode, so it will rotate automatically for the whole round, 360 degree. Now you can see the degree here. You can't see the handle because it's into the vaginal, but you can see where it's treatment for, exactly in the working interface. Okay, after the treatment is done, it will rotate automatically go back into the initial position. So you can do the treatment much easier next time. Okay, you can see as the vaginal is not a short place, it might need a long distance to do the whole vaginal treatment, but you can see there are only 25 millimeters, so you will need to take out. For example, you are doing the vaginal tightening here, you will need to take out the treatment cartridge every time. This is the inside, but the whole vaginal is a long distance. So for first time you treat from the inside to outside. The treatment session is from inside to outside, and the first time is there 25 millimeters as we said here. Okay, so next time you will need to, for example, if you put all the treatment handle into the vaginal, after the first time, then you will need to take out the handle 25 millimeters, which is here 100. You can see the ruler or something. You can see the length here. So take out 25 millimeters, and then start the treatment. Start. Okay, it will, for example, the first time is doing the treatment here, so now it will doing the treatment here. Please keep asking how the client feel when you do the treatment. By the way, even we stop the treatment when doing our treatment, you can. This one can stop the treatment here, and maybe the session is done just stopping here, but next time you will wonder, how can I start from the 0 point, or how can I know where I will start from the treatment of the treatment area here. So even you stop there, next time when you do the treatment, you can put ready. It will also automatically go back into the initial position at 0 degree. Okay, by the way, as we know, there are two different cartridges, 4.5 and 3.0. You can see there is 4.5 millimeter. Okay, if we use both the two cartridges, you will need to use the deeper one, which means 4.5 as beginning, and then change the 3.0 after the first one treatment done. Just take out it here and change. You can see there's gone, there's nothing, but when you put the treatment cartridge, please make the position right into the place. After I insert it well, it will show the treatment cartridge depth here. For these parameters, the residue means the residue is the lower one, means how many shots the handle left, and total is how many shots in for the handle totally are. After the treatment, we don't need, as this is a new technology with high intensity focused ultrasound, so after the treatment there's no need special care after the treatment. Only just normal clean is okay, but someone may get a slightly swelling. It's okay. It will go with most around 5 hours. And if the secretions increase, it's also normal. Just prepare some pads in your bag. It's okay. It will go in a few days. Well, for the sessions, it's normally suggest 1.5 months to 2 months every time. Or if someone feels better, you can do shorter time. Okay, your laser totally needs 3 sessions. By the way, when you do the treatment with any of the vaginal tightening devices, please try use the lower energy, and then you can ask the client feeling and may use higher energy. Just try to start from the lower energy. For the energy, we suggest use 0.6 joule to 2 joule. To 1 joule, sorry, to 0.6 joule to 1 joule. And some after treatment details or cautions. We will also, for example, don't eat spicy, cold, or hot food. Please don't smoke and drink. Eat some more fruits and vegetables. These are all other medical treatment needed. Okay, this is a whole introduction for the SculpLFT 40 HIFU, the operation skills and the treatment, the principle and precautions and after cautions. If you have any questions, you can send us message or just call us to get more info. Also, if you're interested in any other treatment handles for face or body, you can contact us to get more info and quotation. Thank you today.